Today I want to share with you a story that continues to inspire me to help treat patients who have problems with their fertility. So this concerns another passion of mine, and that is in the treatment of endometriosis. Endometriosis is a condition which can be very devastating. It causes a lot of morbidity. Most women with severe endometriosis have very, very painful periods that affects their daily lives. But that explanation is for a later story. So this couple came to see me after they've been married for 5 years, and they have been trying for a baby and getting a lot of pressure from society, from their parents to have a baby. She has had 2 surgeries in the past for endometriosis, and so when we finally got to examine her, we noticed that actually her egg reserve was quite reduced. And to make matters worse, she had another 5 centimeter cyst on one ovary. After a long discussion and plenty of soul searching, we decided to proceed with IVF with the cyst still intact, because further surgery on that ovary would mean that her egg reserve might further drop. So during the IVF, we managed to get 5 healthy embryos for her. We then froze all the embryos. She went for surgery to clear the cyst. Unfortunately, her first transfer did not work, but we are happy to announce that they are now pregnant after a second successful embryo transfer. She's currently 6 months pregnant, and I'm really looking forward to welcoming their baby. So endometriosis is a condition where actually the lining from the cells of the uterus or the womb, called the endometrium, the cells migrate to other places that's not within the uterus, okay? So it can migrate to the muscles of the uterine wall, it can migrate to the ovaries, and every month when you have a period, this lining sheds, and so the cells that are not in their proper position will also bleed. Now, 1 or 2 drops, but blood in places that it's not supposed to be is an irritant. It can cause a lot of inflammation, and because of that, a lot of pain. It also can cause silent damage. So it can cause these things like scarring on the inside called adhesions, and all this actually will reduce a woman's ability to get pregnant. In a woman with endometriosis, sometimes it's advantageous to make sure that the endometriosis is not active before we start any fertility treatment. Because all this inflammation that's going around in the uterus, it actually makes the environment very, very unfriendly for the baby, and so trying to get pregnant becomes a double challenge. However, there is hope on the horizon, and we have many new treatments now to help women with endometriosis. It is possible to get pregnant even if you have endometriosis. Please see your gynecologist so that you can get the earliest and best treatment possible to maintain your fertility.